Welcome to the deep dive. Today, we're plunging into surgical robotics. It's a field that's really changing modern surgery fundamentally.
Yeah, absolutely.
But forget thinking these are just niche tools anymore. They're becoming, integral to healthcare. And our mission for you today is to pull out the key insights from a big investment analysis we looked at.
Right.
Really showing the high growth potential here and, well, what's actually driving it.
And this market, it's not just growing, it's kind of exploding. But there are some interesting details in the numbers.
Okay.
So some forecasts, you see this huge 16.54% annual growth predicted for the whole surgical robotics market.
Wow.
But then others are more cautious, saying maybe closer to 9.42%.
Quite a difference. Why is that?
It really comes down to how you slice the market segmentation. So for example, if you look specifically at the really cutting edge AI-powered robots.
The smart ones.
Exactly. The ones using machine learning, maybe for better visualization or predicting things during surgery. That specific segment, it's surging at like 17.61% compound annual growth.
Okay, so that's where the really explosive growth is.
Precisely. It tells you where the innovation is really pushing things forward and maybe where the biggest opportunities lie for you to watch.
So it's less about just, robot arms and more about making the surgeon smarter, faster, augmenting them.
You got it. And the big drivers behind all this growth, well, they make a lot of sense. Patients increasingly want minimally invasive surgery.
Faster recovery, smaller scars, right?
Absolutely. That's a big draw. Then you've got, an aging population globally, more people needing more complex procedures.
Makes sense.
And just constant tech innovation, especially, like we said, AI and how data analytics are being built right into these platforms. It all creates this powerful momentum.
It sounds like a huge opportunity.
Yeah.
But, in a field like this, with so much at stake, how do companies defend their position? How do they stop others just jumping in?
They build what investors call economic moats. Basically, really high barriers that make it super difficult for new competitors to even get started.
Okay, like what?
Think about the incredibly long, expensive regulatory approvals, getting FDA clearance or the equivalent. That's a massive hurdle.
Right.
Then the R&D costs, the capital needed to build these complex machines, it's enormous. Plus, the big players have huge patent portfolios.
Protecting their tech.
And just the logistics, training thousands of surgeons worldwide on your specific system. That's a huge undertaking. But maybe the cleverest moat, it's the razor and blades business model.
The old Gillette strategy. How does that apply here?
It works perfectly. So companies don't actually make most of their profit selling the robot itself, which can cost millions.
Okay.
The real money, the recurring revenue, comes from selling the disposable instruments used in each surgery and the service contracts. For Intuitive Surgical, they're the big leader with the Da Vinci system. Something like 84% of their revenue comes from these recurring sources.
84%. Wow.
So once a hospital spends millions on the main system and, crucially, trains all their staff on it,
They're kind of stuck.
pretty much, the switching costs to move to competitors' robot become huge. They're effectively locked into that ecosystem. It's incredibly sticky.
That razor and blades model really cements their dominance.
Yeah.
Okay, so it sounds really tough for newcomers, but tech always moves forward. What's next? What are we seeing on the horizon? Fully autonomous robot surgeons.
Well, full autonomy, where the robot does the entire surgery without a human, that's still quite far off, frankly.
Yeah.
Most experts think that's unlikely, even by 2040. There are major ethical questions, and the tech challenges are just immense. But AI is paving the way for partial autonomy.
What does that look like?
Think of robots handling specific, maybe repetitive tasks very precisely, like suturing or identifying certain tissues, but always under the surgeon's direct supervision.
Okay, so the surgeon is still very much in charge.
Absolutely. It frees them up to focus on the critical decisions. But something happening much sooner, a big strategic shift you should watch, is the move towards ambulatory surgical centers.
ASCs?
ASCs.
Outpatient centers. How do they fit in?
They're actually the fastest growing place where surgeries are performed. And they have different needs. They want smaller robots, more mobile ones, and critically, systems that cost less upfront.
So not the giant hospital systems.
Exactly. This creates a real opening, a major opportunity for newer companies, perhaps, to challenge the established leaders by offering systems tailored for these ASCs. Cost and size become huge factors there.
Interesting. So pulling this all together, based on the analysis, who are the key players for you to know about?
Well, you've got the established giants, obviously. Intuitive Surgical is still king in general soft tissue surgery. Stryker is the leader in orthopedics. They offer, stability, proven track records.
A safe bets, maybe?
You could say that. Then you have major players challenging them. Medtronic with their Hugo robot and Johnson & Johnson are making serious pushes into that soft tissue space, going after Intuitive's market.
Trying to get a piece of that recurring revenue pie.
Definitely. And don't overlook the niche specialists. Companies like Globus Medical, they're growing fast in spine surgery robotics. And Procep Biorobotics is doing really well in urology with their system. They find success by focusing very specifically.
It's amazing how these technologies just keep pushing what's possible.
It really is. And it leads to a pretty profound question for you thinking long term. As robotic surgery gets even more precise, more accessible, how might it fundamentally change healthcare access and maybe even lead to more personalized treatments within your lifetime?
Yeah, that's the big picture. Ultimately, keeping up with these leaps in technology isn't just about investing or market trends. It's really about understanding the future of your own health and well-being.